Today we will talk about the FP5000 foot pump. The FP5000 foot pump is a non-invasive system which provides external pneumatic compression to the foot. It is comprised of the pump and a pair of single patient use foot garments. The foot garments are packaged singly and are unisex as well as universal. They are for male or female, and they are for left or right foot. The standard size would be for women up to size 9, men up to size 7. And that will have the blue insert inside your package. The large would be a pink insert, and they would be women 9.5 and above, and men 7.5 and above. Also singularly packaged. The pump will deliver 130 millimeters of mercury of pressure alternatively to each foot for 3 seconds every 30 seconds. This is the recommended default setting that your FP5000 foot pump is set to. Anytime you power off and power back on, it will always go to those recommended settings. The FP5000 foot pump is used to help improve blood flow as well as prevent deep vein thrombosis. Some clinical applications for the FP5000 system are as follows. We said prevention of deep vein thrombosis, enhancement of venous and arterial circulation, prevention of venous stasis. It will help assist healing of cutaneous ulcers, including venous stasis ulcers, helps reduce of acute and chronic edema, as well as reduction of compartmental pressures. If the patient is experiencing any tingling, numbness, or pain while using your FP5000 foot pump, they would like to discontinue use immediately. The FP5000 foot pump is recommended not to be used in the following conditions where an increase of fluid to the heart may be detrimental: severe congestive cardiac failure, known or suspected acute deep vein thrombosis, or pulmonary embolism, as well as any untreated infected legs. When setting up your FP5000 foot pump for use, you will notice on the back side of the unit you will have your grab handle where you would make all maneuvers from your unit. You do have your hanging brackets that you would open and use to hang your FP5000 foot pump on the footboard of the bed. On the top side of your unit, you do show here your recommended default settings that are pre-programmed every time power is deactivated and reactivated. On the top side here, you do show your fault reference chart if at any time your display would show a low, high, or F failure display to signify any pump fault or pump failures. This on the face of your unit is your display, which will display the pressures between alternating cycles of each inflation of the garment. Here you do have your setting control button. In order to make any control setting changes, your control setting button will need to be held down at the same time while pressing either your cycle second button, your inflation hold seconds button, or your pressure millimeters of mercury button. You do have a pause button, which will pause your unit at any time in order to check for any disconnection of the garment from the hose or the unit, as well as check for any kinks in the tubing. And you have a single garment, which will be needed if using only 1 foot garment while you're using your FP 5000 foot pump system. You do have here your female snap lock collectors, which will connect to your FP 5000 foot pump tubing. Your FP 5000 foot pump tubing is clear in color. It does have male and female side connections, as well as they are not discardable. Please return the tubing with your FP 5000 foot pump upon pickup. Your garments are single patient use only and are disposable. To proceed with our setup, we would connect our male connections of our tubing into our snap knot collectors on our FP 5000 foot pump. Push it firmly in so you hear it snap into place, doing one at a time until they are both firmly connected. After you hear them both snap into place, you may slightly pull on the tubing to make sure the tubing is securely locked into place in the snap lock connectors. Then you would follow your length of your tubing to your female connections, where you would use those female connections to connect to your foot garment. Your foot garment, we said, is single patient use only, male or female, left or right foot. When setting up the foot garment for the patient to use, you would first want to expose your tubing to connect to your tubing extending from your foot pump system machine. Unvelcro your Velcro straps to show the base of your garment. At the base of the garment, you will show a heel section. The heel section is where the back of the heel should be firmly planted. Once the heel is placed in the garment, you would take your garment from the side and wrap it over the outside towards the inside of the foot, covering the sole of the foot completely, wrapping it snugly, and then taking your Velcro straps and strapping them over, securing the patient's foot into place. On the back side of your garment, you do show here another strap, which is used to strap around the patient's ankle to help secure the patient's foot in the garment. If using 2 garments, the same process will be needed in order to apply to both feet. So we will open up our second package, display our tubing. Once again, unstrap your back strap for your heel adjustment. Unstrap your Velcro strap for the top side of the foot to strap the patient's foot securely into the garment. Check for your heel. Fold the garment over. Velcro the strap in place. With the patient's foot securely in place, wrap the back garment around the back of the ankle, and then you would have both garments, once on each foot. Once both garments have been applied, you will finish off your connection to your foot pump tubing, male to female connections. push them firmly together until you hear them snap into place. Once the garments have been applied to the patient's feet and all tubing has been checked and secured, then you may begin to power on your FP5000 foot pump. Your FP5000 foot pump power switch is located to the opposite side of where your tubing connects to, here. When powering on, you will need to push the power switch into the on position. When it does power on, you will show your display to display your numeric setting or error message if error message were to apply at the given time. Every time your pump does power on, it will go to the recommended settings of 130 millimeters of mercury of pressure to a cycle seconds of 30 seconds in between each garment inflation and a inflation hold time of 3 seconds once the garment has been inflated to 130 millimeters of mercury. If the physician were to recommend increased pressure settings other than 30 seconds, cycle seconds, 3 seconds for inflation time, and 130 millimeters of mercury for pressure, you may change the setting by holding your setting control button down while keeping it depressed, pressing the desired function to change. So we change that from 30 to 45 to 60. If you want to change your inflation hold from 3 to 4 or 5, continue to hold your setting control down and press your inflation hold. If you would like to change your pressure, same thing, hold your setting control button down and then press your pressure button until the desired pressure is obtained. Once all settings have been preset, you may go ahead and release your setting control button in order to save and lock in those settings. If at any time you will need to pause the unit, you may pause it at any time. If the garment is being inflated during the time the pause button is activated, the garment will automatically deflate for patient safety. During the pause mode, that will allow you to check your tubing for kinks, check your connections, inspect your garments for any leaks, or rewrap your garment if it's loosely fitted around the patient's foot. Okay. To unpause, simply press the pause button again and you'll resume as was. Now, if using only one garment for the patient foot pump therapy, you will need to activate single garment. To activate single garment, simply press single garment at that time. Single garment will illuminate the light displayed, letting you know that the single garment has been activated. Once it has been activated, you may disconnect one of the hoses and then only keep the hose that's connected to your garment connected to the unit. If you are not using the single garment, you must always make sure that both tubings are firmly connected and that your single garment is turned in the off position. If you were trying to use single garment but did not activate the single garment when you do have your hose disconnected, you may get an alarm reading on your display. So we'll wait approximately 2 cycles to cycle from one foot to the other foot with our hose disconnected in order to try to display an alarm setting. So we're currently waiting 60 seconds for the cycle setting that we have pre-programmed. If you look here, it shows a high pressure alarm. Your high pressure alarm usually persists due to the fact that your hose is disconnected at the unit, or your hose is also kinked as such. If your hose is kinked, repair the kink, roll the tubing in your fingers to work out the kink. If your hose is disconnected, reconnect your hose. After checking all of your tubing and making any reconnections if necessary, simply observe your display for 2 cycles to see if your alarm persists. If your alarm has gone away, the situation has been rectified and you may resume therapy as normal. If your display reads low pressure or LO, that will signify that your garment itself may have a leak. You may need to check your garment and replace it if necessary. If your display does display F, as in failure or pump fault, do not use your FP5000 foot pump. Please discontinue use as soon as possible. Give Advocare Systems a call so that we may set up service to have your FP5000 foot pump switched out with another one. So at this time, we had set our machine to a cycle of 60 seconds, inflation hold of 5 seconds, a pressure of 170 millimeters of mercury. We are going to power off. Every time we power off, we said when you power back on, your pump will go to a self-test cycle and then automatically change the settings back to the recommended default settings of 3 seconds for inflation hold, 30 seconds for cycle time, and 130 millimeters of mercury for pressure. If your unit does become soiled and does need to be cleaned, please do not spray anything directly on top of the unit itself. Get a damp cloth with a mild soap and water solution. Wipe the surface of the unit down with a damp cloth. Dry it with a dry cloth. Then you may place away for storage until the next use. If at any time you do have a power failure or there is no power on your display, always check your power switch as well as check your power outlet to make sure you have power active in the outlet or your unit has not become unplugged.